Hi, good morning everyone. My name is Komal and I'm going to represent about the presentation that emergency equipment assignment that we have, and I'm going to choose topic that is cardiac arrest situation and what should be our responsibilities when we face that kind of uh, condition. So to be honest, initially I would say being a flight attendant is hard to face different situations because we can't predict what's gonna happen on the flight. And cardiac arrest having on the flight is one of the most common thing, because when the altitude change, many of the people's body react in a different way, and sometimes their blood pressure and their breathing system is not in a working in a proper way, so that sometimes for mainly for the old age people ends up in the cardiac arrest situation. So when a person encounters the cardiac arrest, that usually comes when the heart usually stop beating or slow down their process, or the prevent the blood flow from the body to brain and the vital organs. And for that, we can see the symptoms like they have the issue of breathing, they can't breathe properly, and sometimes they get unconscious, and there is no pulses, and their face color changes to pale, and they couldn't respond to you. So that mainly the signs happens, because sometimes they sweat too. So when we hit that kind of situation on flight, so after observing these symptoms, so first thing that I believe that we should definitely assess the situation. We should check the pulses of the person, and whatever he is feeling, and we just have to identify if the person can respond. If the person is not responding, then we should call for help from the crew first of all, because that should be our priority, because we can coordinate with them. But if nobody is around, we can help for the passengers. And then the first thing we need to do afterward, we have to inform to the flight deck, and if possible, the captain may decide to divert their flight to a nearest place where they can land, so that they can assist that person who is having the cardiac arrest, because it's a medical thing and medical professionals need to be there. If they are not there, then whatever is possible, we should do that. And another thing that I believe, that they should start CPR, so that they can make the rhythm of the heartbeat of that person, so that the person can breathe properly and the body functions properly. And while continuing that, we can also use the AED, uh, uh, that is like a automated external defibrillator, so that we can send a proper shock to the heart, so that the heart can start beating in that with that shock. So that is a equipment that we usually use in that medical emergency use it. And then after, while using that, we can also we have to address the other people also, because there is a lot of passengers on the flight that we have to deal with, because this kind of medical emergency comes with a lot of chaos and everything, and for that we have to make things very calm, and we have to assure them that everything is in control and we are helping that person and everything gonna be okay soon. So we have to be very calm, patient, and we need to be in communication with the people, so that the flight can be in the can be smooth, so that they don't feel any issue in that. And we should also coordinating with the crew, so that we can understand what's going on and what we can do the best, because if we have the proper coordination with each other, then the things can be better soon. And we should keep tracking the situation. We should keep informing the flight deck and our crew and the people though until unlimit, so that they can calm themselves also. So proper communication is very important in this kind of situation. And many of the resources that we can have on flight is like a first aid kit, that usually have the bandages, antiseptic wipes and stuff. And the other thing that I have mentioned, AED, the automated external defibrillator, And then another thing is emergency medical kit, which usually have the medications and stuff. For example, the stethoscope, the a blood pressure cuff, so that if somebody's blood pressure is going high, so that we can check it and we can help them. And another main thing is oxygen system. So if that usually have on the upper side on the seat also, so that if the somebody is having problem while of breathing, then they can use that oxygen system to have the proper amount of oxygen too. And so in the end, that I would say that being on flight, we need a lot of precise education and the knowledge to manage that things. And we, while doing that thing, we also need to know how to manage the passengers, because that thing plays an important role, because everything will be in the panic, then we also couldn't treat that passenger properly who is having the cardiac arrest, because otherwise the person gonna lose their life. So it is necessary to make a balance between that situation and the passenger, so that they can be calm also, and the passenger who is having that cardiac arrest issue can be handled properly. So that's what I have to share as per a medical emergency procedure that I believe. Thank you. I hope you would have enjoyed it.